Assalamu alaikum. My name is Nasir Deeb. I am director of Halal Expo Canada. Welcome and thank you, ladies and gentlemen, for joining the first Halal Lifestyle and COVID-19 webinar. The aim of the webinar is to debunk and have a better holistic understanding of the approaches, implications, and measures to take as Muslims as this pandemic is affecting us. The organizer of Halal Expo Canada 2020 need to better understand the measures and take the right approaches and have the implementation plan. I would like to welcome Mr. Zackariya Muqtadir to moderate this session. Zach, please go ahead.
Firstly, thank you, Nasser, for having me on board, and thank you everyone for joining us for our very first webinar focusing on the halal lifestyle, which has been and how it impacts how it has been impacted by COVID-19. Today we have numerous panelists to enlighten us here who have taken time out from their busy schedules to deep dive into this topic of taking basic measures during this pandemic, its aftermath and implications on the halal lifestyle. I'm going to go ahead and proceed with introducing our panelists. First off, we have Nour, who is an emergency physician in the GTA. She's currently working in COVID clinics and an educational lead, preparing hospitals and staff through this high-fidelity COVID drills and simulations. Currently, she's doing a short-term assignment at the Fort Smith Hospital in Northwestern Territories. Dr. Khatib actually has a degree in finance and an MBA before she ventured into the field of medicine. She was a financial analyst with Pratt & Whitney Canada. A fun fact about Dr. Khatib is that she is a voiceover artist on voices.com and has done a few commercials, including the Hershey one. That's really impressive. Second off, we have Dr. Nazir Khan, who is a neuroradiologist in Hamilton and an assistant professor at McMaster University, and also the president at Yaqeen Institute Canada. A fun fact about Dr. Nazir is that he is an explorer and adventurer and has driven across Canada from Vancouver to Toronto. Lastly, we have Dr. Hamid Abdelrhman, who is a clinical pharmacist based out in Calgary and is also the founder of Canvita Health Halal Vitamins. That's also based out in Calgary. A fun fact about Dr. Hamid is that he is an international chess master, and in his early days in Canada, he used to work as a chess coach. Really impressive. So thank you once again, panelists, for being part of this first webinar. I'm going to explain to you what the format of the webinar will be. We have a series of questions lined up where each of the panelists will get one question in the beginning, and then we'll have the second session, which will be more open-ended, open call to answer the questions. And then lastly, we'll conclude with some final thoughts and some takeaways from you folks and by Nasser. So first, just quickly getting into it, I'm going to fire off the first question to Dr. Khatib here. So what are the basic measures we need to consider to protect ourselves given the current pandemic that we're going through?
Absolutely, fantastic question. So I'm speaking to you today from Fort Smith. So thanks for having me. I'll start. But yes, absolutely. Everyone needs to think about how they're going to protect themselves and how they're going to protect others. Even if you're young and healthy, you need to realize that this disease or this virus can still be with you, and you might be infecting other people. So the best way to keep protected, number one, is frequent hand washing. And alhamdulillah, we are, we do wudu 5 times a day and we're clean, but we have to take even extra steps in hand washing. And if we don't have a sink available, then the Purell or the hand sanitizers is enough. Another step to do is whenever you leave the house, wear a mask. Before we were telling people wear a mask only if you have a cough. But nowadays, now the fact that it is that sometimes people are carrying this and they're asymptomatic, meaning they're not showing us any symptoms. So in fact, if you leave the house, wear a mask. If you do not have a mask, I personally do not own a mask personally. I get them in the hospital. So when I go out, if I need to go out to the grocery store, then I can put a scarf over, and that should be sufficient just to keep other people protected from you. That's the purpose of the mask. So main things is frequent hand washing, wear a mask, and just be vigilant. Stay away from people who are sick. And if you're sick, stay home. Listen to what our public health department is saying. And the main thing is, if it's not essential for you to leave the house, then do not leave the house. There will be a day, hopefully soon, where we will gradually return, and just realize that, you know, we really are all in this together, and step by step we'll be able to go back, hopefully, to a life that feels similar to before.
Absolutely, really well said, and thank you for those enlightening thoughts there. I'm going to progress further actually, and get our second question in. So the second question is for Dr. Nazir Khan. So how can we as Muslims make the most of life during these current circumstances slash restrictions that we currently are all facing?
Yeah, that's an excellent question. And first of all, assalamu alaikum, and thanks for having me. So I think there's a few things that we need to think about, right? We need to think about, you know, with everybody stuck at home, there's obviously additional stresses that they're encountering. People are sometimes in confined living spaces, big families, you know, it can be very stressful. So there's mental health to think about, right? There is, of course, the physical health that, you know, Dr. Khatib just talked about, and that's, you know, taking precautions to ensure that we're not passing on the virus to others. And then there's also the spiritual health aspect, right? From, you know, for us as Muslims in the month of Ramadan, how can we make the most of this opportunity? How can we maximize our spiritual growth in light of some of the other challenges that we're facing? So just to kind of take those three in turn, for the first one, in terms of mental health, what I would say is that, you know, it's really important that families come together and discuss some of the challenges that they're experiencing during this time, right? And discuss a plan of action to address those challenges, right? So people may have different needs, and they're all, you know, all stuck in the same space. What they need to do is they need to try to alleviate some of that stress. It may be something as simple as taking time during the day to go outside for a walk. It may be something as simple as ensuring that everyone in the household partakes in the chores so that the burden of responsibilities are not all falling on one or two individuals. So there's different things that can happen, but it's important that people think about mental health and they think about stress, because for the majority of us, the way that this COVID-19 situation is affecting us is not directly in terms of, you know, us being immediately involved in with other people who are sick. For the majority of people, it's actually just the mental health burden that's affecting them. And so that's something we really need to take seriously, because we know that this can be associated with increased anxiety, increased depression. So the advice that I have for everyone is really take care of your mental health. Take some time during the day for self-care. Take some time during the day to alleviate some of the sources of stress. So people who are tuning into the news every single day and, you know, spending, you know, 1 hour, 2 hours, 3 hours just reading all these feeds, looking at these exponential graphs of COVID-19, you know, do you really need all that information? Is that actually going to be helpful to you, or is it going to possibly have a negative impact on your mental health? That's the thing to think about. The second aspect, in terms of the physical health, I don't think I need to mention much about that, because Dr. Nour Khatib really summarized that very well in terms of taking the same precautions that people are talking about. So social distancing, or physical distancing, is really the better term, because we want to stay socially connected, but separate ourselves in physical spaces when you go outside. When you're going outside and getting groceries, you know, take a little bit of extra precaution as well. There's always going to be a certain limitation of how much you can do, right? You wipe down every single surface when you come home. Do the best that you can, and realize that every step that you take, you're minimizing the chance of infection, right? So, you know, there's only a certain amount you can do with wiping every single milk bag that you get from the grocery store and every single fruit, but you do the best that you can. So that's in terms of the physical health. And the final thing that I want to comment on is in terms of the spiritual health, right? So during the month of Ramadan, this is an opportunity for us to focus on feeding the soul, right? The rest of the year, we're so focused on feeding our bodies. And now we have an opportunity during this month of fasting to focus on that spiritual nourishment. So what that means is that we need to try to shift our attention from the sphere of this dunya, from the sphere of this worldly life and the worldly distractions, and focus on our relationship with God. right? Focus on our relationship with Allah. And that requires, taking some time during the day for some spiritual reflection, reciting verses of the Quran, trying to increase some of our voluntary prayers. And one of the things that can be a challenge for people, particularly in the COVID-19 situation where everybody's stuck in the house at the same time, is there's a lot of chores, maybe looking after the kids, there's a lot of household chores. And it's important that people, don't be selfish, right? It's not all one person's responsibility and the other person is assuming they're going to have all the time to themselves to recite their Quran, because all of this is an act of worship. Islam teaches us that everything that you're doing to serve your family is an act of worship. So the important thing is to manage your expectations, right? This is not going to be a Ramadan where we're just free we don't have any stresses and we're just going to be totally relaxed. For the majority of us, there are a lot of stresses during this month of Ramadan, but do the best you can. Every step that you take is going to be instrumental in developing your relationship with God. Whatever steps that you take are going to be conducive to your spiritual growth. So I think that kind of summarizes how I would address that.
Absolutely, Nazir. Thank you so much for that. That was brilliant. Thank you so much for that brilliant breakdown and covering from head to toe and even your soul as well. So I appreciate that. I'm going to transition into the third question that we have for Dr. Hamid Abdelrhman is what advice do you give for our community with regards to observing Ramadan during the COVID-19 situation?
So Bismillah ar-Rahman ar-Rahim. Thank you so much, guys, for hosting me. I think it is very important to think about that COVID-19 in Ramadan as opportunity for us. So let us think in the bright side that we stay at home with our families. So it is very good time in Ramadan to stay with our families. We watch our kids, as Dr. Nazir said, that the spiritual part. But I want to talk about something very important. In Ramadan, it is very important to start to increase or boost our immunity. To do this, we need to change our lifestyle, and this is very good opportunity in Ramadan because now we don't eat 3 meals a day. We just eat 2 meals a day. So it means that we can live with 2 meals. So this is something very important. What I would like to recommend people that Ramadan is not a month for food. Ramadan is a month that we change our life. So first of all, I recommend to increase water intake, drink lots of water, protein intake, fruits, vegetables, dates. Try to avoid overeating. At the same time, avoid salt, fried, oily food, white carbs. And this way we can get back to our shape. The other thing is recital Quran and all these things will relieve our depression and anxiety, and that will boost our immunity as well. Exercise is very important. Work out just half an hour before breakfast. That will help our immunity as well, and it will increase our blood circulation. Lots of things about increasing our health with working out. So it is very important in Ramadan that to keep our immunity very high, we stay at home. It's a time, inshallah, it will go, but we try to maximize, the benefit of Ramadan that can reflect our life after Ramadan is done. Mm-hmm. So I think this is, plus we'll come to the vitamins area. So the vitamins area, I believe it's important to eat fruits, vegetables, and to get supplements, multivitamins, vitamin C and vitamin D and stuff.
Perfect. Thank you, Dr. Hamid, for that enlightenment as well. So moving further on, we have one other question. So 2 other questions here, and these are open-ended questions for any of the panelists to take up. It's with regards to congregational prayers and community gatherings or trade events, such as the Halal Expo Canada that's happening in September. What measures are you going to be taking to actually help with following precautionary measures? What advice would you give? So it's an open question. Anyone can take that.
I can take that, and I'm sure my colleagues can definitely join after. First of all, thanks, guys. That was very well said, and I'm very, very, proud to be part of this community with with individuals like yourselves. And to answer your question, number one, it's at this point, we cannot congregate, we cannot meet in person. We will find other ways to make this work, right? We're a wonderful community. We'll find ways, like Hamid said, it's social distancing is the wrong term. This is the last time, like this is not the right time to social distance. This is a time to physical distance. In fact, we need to be as social as possible. And then when it comes to our deen, we need to be as and when it comes to our deen, we need to be as spiritual as possible and take advantage of this month. And in previous years, we take advantage of this month by, going to the mosque, meeting family and friends, doing prayers together. But at this point, we can't. Our deen, alhamdulillah, we've learned that if you have garlic breath, you should not go to the mosque and hurt your brother or sister with your garlic breath. Imagine if you had a virus. Now, just think about that. There's logic, alhamdulillah, to our religion. There's so much logic, and think about the virus as, of course, worse than the garlic breath. So we need to make sure to stay away from each other physically, but keep connected socially and spiritually.
I think that's, really nicely summarizes the important thing to focus on. And just to add to what Dr. Khatib mentioned, I think that we were talking earlier about how this situation is quite uncertain, right? And it's difficult for people to predict what's going to happen a month from now, 2 months from now. Things change so rapidly with this virus, and we've seen that in the previous weeks. So the important thing is to always follow the best advice of the medical professionals, right? And the advice that's coming down from the medical experts with respect to what are the necessary restrictions we need to have in society. So there will come a point, hopefully, inshallah, that we're going to see in the future where we see some of these restrictions easing off, right? And we've seen different health authorities release their projections and models about where they foresee the cases starting to decrease and getting to a point in time where the restrictions start coming off in layers, right? So there may be a point in time where the essential services start expanding again. More businesses are opening up. People are still restricted for how large their congregations can be in groups, and gradually those restrictions start to come off. So the important thing for people is follow the counsel of the medical professionals, of the medical experts who are looking at what are the risks right now. Right? We can't always predict what it's going to be like, a month from now, 2 months from now. There are certain projections, but projections are, based on the mathematical data that you feed them, right? So we don't know for certain what it's going to be like 2 months from now, 3 months from now, but follow the advice of the medical professionals now regarding maintaining physical distancing.
Absolutely. This is really well put by both by Dr. Khatib and Dr. Khan here. Dr. Hamid, did you have anything to quickly add to that?
Actually, what all of them, they said it's very important. If the Prophet ﷺ prohibited us to go to a mosque if you just eat garlic, so it's very important not to go, to the mosque if you have virus or coughing or something like that. And this is not only for Corona time. I believe this something should be after even the Corona time. That if you are sick, just stay home, right? If you feel that you can harm someone else, so just stay home. It's very important. Just only not Corona. We need to make this our habit. And you will find all of guidelines, everything is coming from Islam. So you'll find a root for anything in Islam. So the thing is, what I recommend everyone, please try to follow what our Prophet ﷺ mentioned and just read about it. When there comes of the epidemic or pandemic, so there is some rules that we need to follow. The best people to guide you is, your doctors, your healthcare professionals. They can guide you to this.
Absolutely perfect. Thank you so much. Really well said once again. The other question I have is, once again, open-ended question for all the panelists is, how do you manage your vitamin intake supplements during the holy month? What recommendations do you have about this? Absolutely, go ahead.
I'm gonna answer because I have Canvita vitamins, so this is one of my expertise. What I do recommend, even we produce vitamin stuff that people start to eat healthy. So if you eat healthy, you eat fruits, vegetables, fish, and natural stuff. So you will in the safe side. But if not, and this is the majority of us that we don't eat healthy, so I do recommend to start to take vitamins. Now, our pharmacy shelves are out of vitamin C. People, they start to recognize that vitamin C is very important because it can boost your immunity. So the thing is, we don't want to get to this point. We need people to take vitamins regularly. So what I do recommend, according to the Canadian guidelines and other guidelines, that multivitamins are very important. Multivitamin will give us what enough for for everyday's vitamins, and I think most of us, we have multivitamins over the fridge. We just buy it, we keep it over the fridge, and nobody take it until it's expired. So most of people, they carry this one. So I think it's the time now to start to take it. Vitamin C, because of immunity, it will help. Vitamin D is very, very, very important. Lots of studies about vitamin D that can help our immunity, especially toward any virus that can hit our lungs. So vitamin D is very important. And guidelines, anyone can ask their doctor or pharmacist about the guidelines of these vitamins. Omega-3 is very, very important because our fish intake is very low. So I think omega-3 will play a big role in our health right now. And other vitamins are very zinc. It can boost your immunity as well. During Ramadan, we can take it with the biggest meal, with dinner. If you have any warning or caution, just ask your doctor before taking any vitamins. Alhamdulillah, we have vitamins now. It's halal, so because most of people asking about, oh, there's gelatin here, what can we do? We cannot take vitamins. Alhamdulillah, we are trying to make all the most important vitamins in the market in the halal formulation. So we will have no excuses.
Awesome, perfect. Thank you so much for that. Lastly, as we're coming to the end of our webinar, this is a question I'll ask each one of you. It's to really give us your final thoughts and one takeaway that you would provide to the listeners so that they can implement in their daily lives, whether it be with regards to staying at home, and whether it be spiritually, physically, mentally, whether it be in terms of the vitamin intakes, whether it be taking precautionary measures when we're out at the grocery store. So, I'll leave it to you folks to give me one thought. We'll start off with Dr. Nazir Khan, actually, to give us a final thought and a takeaway message.
Sorry, I was going to say, I think Dr. Nour had something she wanted to add first.
Okay. Oh, sorry. Yeah, maybe before the closing thoughts, if you don't mind.
Sure.
I agree with most of the things you've said about vitamins, except at least we've learned in medical school is that if you have a balanced diet, you don't need extra vitamins unless, of course, you're pregnant. Then you need multivitamins. But if you have a balanced diet, and I agree with you that a lot of people don't, then you won't need vitamins except for vitamin D. That's the one that us in Canada, we don't get enough sunlight. Even when we do get sunlight in the summer, it's still not enough. So vitamin D is the one that you absolutely need. In terms of vitamin C, as you've correctly mentioned, is that some studies say that it could help with your immunity prophylactically, meaning before you get sick. And with regards to other vitamins, if you have a balanced diet, then that's actually much better than taking a pill. Alhamdulillah, the food and the ni'mah that Allah has given us is more than enough to feed our bodies and our souls. And it's just the vitamin D simply because we live in Canada. And as for my closing remarks, I just want to say we're so blessed to have such incredible members in our community. And the one thing I would want the group to take away from this is patience. And the medical community thanks you for your patience and thanks you for staying home. And we know it's hard, I have to tell you, the one day that I'm not working and I'm home and I'm by myself, I think to myself, wow, how are people doing it? Those who are not working and are at home, how are people doing it alone with your thoughts? And it's hard, but you will be able to get through this. We'll be able to get through this together as long as we physically distance and never socially distance. Just physically distance and stay connected, and just keep your patience. Keep your patience. Have the sabr to get through this, and inshallah, we will.
Yeah, Nazir, I'll let you, thank you, Nour, for that enlightenment there. Nazir, I'll pass it back to you.
Yeah, I think that's a really important message, what Dr. Nour Khatib just mentioned. And just to add to that, you know, I think the important thing to reflect on spiritually for us as Muslims is how often the Prophet Muhammad, peace be upon him, emphasized the nature of community, that, you know, when one part of the body is in pain, the entire body feels pain, right? So in the same way, that's how we are as a community, right? When one part is in pain, the whole body feels pain. And there's very few things that remind us of how connected we are, you know, more powerfully than the example of this pandemic, right? We really do see how it illustrates that we as a community, as a global community, are all connected, right? And what happens in one part of the world ultimately affects all of us. And so the important thing that we need to do, I echo that message of patience, perseverance, endurance, and turning back to Allah subhanahu wa ta'ala, turning back to God, and putting our trust in God that, you know what, there's a concept in Islam. One time a Bedouin came to the Prophet Muhammad, peace be upon him, and he said, should I tie my camel or should I put my trust in God? And the Prophet Muhammad, peace be upon him, said, "Aqilha wa tawakkal ala Allah," right? Tie your camel and then put your trust in God, or tie your camel and put your trust in God. So in other words, we have to take the physical means, right? We know based on science what we have to do, the different precautions, and ultimately we recognize that the results are in God's hands, right? And we do our best that we can, and then, you know, we put our trust in God and we maintain optimism and a hopeful outlook.
Beautifully said, both Dr. Khatib and Dr. Khan. Thank you once again for that. Really well received and well said. I'll pass the last final thoughts and final remarks to you, Dr. Hamid. Take it away, please.
I think, you know, all of us, we used to live in this very busy life. So now, subhanAllah, God give us a break. So to staying at home, so it's a break. So I think it is a time to recalculate our life and to start to use our life in the best way. So it's time now to read about our religion, to recite Quran, to, you know, to start to read books, and, you know, it's time. It's, you know, we stay at home doing nothing. So it is important to fill this time with very useful things to do. Keep our body healthy, eat and change our lifestyle. You know, summer is coming, so all of us, we need to be fit for summer and be optimistic. Inshallah, everything in God's hand, and we just you know, we know that our God is making everything for our best.
Absolutely, absolutely, amazing. Well, I can't echo enough the value that this has created for our listeners from many different facets of life, and this is enlightening, and I'm privileged to be part of such a wonderful panelists here. I wanted to sort of you know, send out the final remarks and final thoughts, and loop in the executive director of Halal Expo, Nasir, to just kind of give Nasir to just give us his final thoughts and how he plans and what strategies does he have with his Halal Expo that's coming up in September 2020. You know, we'd like to hear your final thoughts on that, please.
Well, first of all, I want to thank everybody for supporting us and coming on board, because we had many people asking us many questions, exhibitors and attendees, about what's going to happen to the show industry, what's going to happen to this and that. And we wanted to make sure that we don't talk about the business only. We want to talk about the well-being of the people and the health and of our attendees and exhibitors and the whole community in general. And we appreciate that you guys came on board and enlightened us. I mean, myself, I've become more educated now about this virus and about the health factors that I can learn from this and I can take from this. And I really appreciate all of the doctors who are being in the panel for giving us all this information, and I appreciate that. As far as us, we are a B2B trade show, and we are not a public event. So we have a little bit, let's say we are safer, but it's a bit more controlled. We are planning if things, inshallah, if things goes back to normal by September and the show will go on, and we cannot, as Dr. Nour says, we cannot predict the future, but we're hoping that things will get better. If it does get better and things are opening up, we will take all the measures. We work with Mississauga City and the City of Toronto on how to follow the compliance and make sure that we educate our exhibitors and attendees way in advance before coming to the show. I'll give them the heads up and make sure that we are planning to even distribute sanitizers to all attendees and participants. We're planning also to widen the aisles, put some signage to tell them that try not to be close to each other as much as possible. We're trying also to find ways where we can, ask him not to shake hands, and that way we're going to work in so many ideas with you guys, and I'm going to come back to you to also make sure that I follow the compliance and work with the city and with the venues to make sure that we ensure the health and the safety of our participant at the show. And we want to work on that. I'm sure things will change in our industry, but the good thing is we are more a controlled audience, less audience. We only focus on the professional and the business people. We don't allow families and big gatherings. So we will try our best, if things goes back to normal, to maintain that level of safety and health. And again, I cannot say anything more, but really I've been enlightened with this session. I have learned so much, and I appreciate that. And I hope that to have you again answering questions, that we're going to have more questions coming up from our followers. We have lots of followers on our social media that are going to probably ask you many questions. And we hope that next time we go live and you'll be able to answer these questions. I'll give it to you, Zach, for the closing. And I thank you once again for everything.
Thank you, Nasir, for that as well. And I do see that, hopefully, inshallah, with the patients that we have, and with the efforts that we put in, both spiritually and physically, things inshallah will change. And with Nazir really saying it really well, is that you have to first hire camels and also have the tawakkul Allah. So that's really crucial to keep that as our motto as we progress forward. So once again, I want to really thank personally Nasir for having me on board as a moderator. I want to thank Dr. Nour Khatib for being here on your busy schedule and calling in right from the hospital. I want to thank Dr. Nazir Khan as well. I know you're also really busy as well, and thank you once again for shedding light from a spiritual standpoint as well. And finally, I want to also thank Dr. Hamid Abdelrhman for tuning in from Calgary. I see you're in a patient room there, so you're also quite busy as well. So thanks once again, Jazakallah khairan for being here. And viewers, look forward to our next live Q&A session that's happening on Wednesday at 3 p.m. That's next week. Thank you so much from the Halal Expo